What are the treatments? Croup often occurs at night and can be frightening to both you and your child. Still, it is important to keep your child calm, as anxiousness and crying can make symptoms worse. If your child wakes up at night with symptoms of croup, take him or her into the bathroom and run a hot shower or bath water until the room steams up. Steamy air seems to help break up the mucus and ease the symptoms. Keeping your child in an upright position can also help make it easier to breathe. When the symptoms have improved and your child goes back to bed, running a cool mist vaporizer in the child's room can help minimize symptoms. Vaporizers that use heat to generate steam present a real hazard for scalding burns and should never be used around children. Children's Tylenol, or acetaminophen, or children's Motrin, ibuprofen, can be given to relieve mild fever. Over-the-counter cough and cold medicines are generally not effective in relieving the symptoms of croup or in shortening the duration of the illness. Note that children's Motrin should not be given to children under 2 years of age, and children's Tylenol should not be given to babies under 6 months of age without first consulting with the child's doctor. Even if symptoms get better with steam or a cool mist vaporizer and medication to reduce the fever, it is a good idea to call your child's doctor the next morning and make an appointment if recommended. If symptoms do not improve with steam and moist air therapy, you may need to take your child to a local emergency room for examination and possible additional treatment with epinephrine, a drug that helps open up the airways, or corticosteroids. Corticosteroids reduce inflammation, swelling, and irritation and may be given to your child through an inhaler, an injection, or as a liquid or pill that is taken by mouth. For severe symptoms, epinephrine and/or corticosteroids may be administered through a device called a nebulizer. This device mixes a liquid form of the medication with a fine mist of moist air, which is then inhaled through a mask. Because most croup infections are caused by a virus, there is usually no need for antibiotic treatment.